Welcome back to Sunrise. Thank you very much for staying with us. If you've been with us from morning, thank you. We appreciate it. If you're just joining us, thanks for coming along. Well, September is Prostate Cancer Awareness Month, and this morning's checkup is all about men's health. Now, prostate cancer is one of the most common cancers affecting men globally, but with early detection, outcomes can be significantly improved. Urologist Dr. Dean Wong from Neo Medical is here to walk us through the risk factors, some of the symptoms, screenings, and the treatment options available. Good morning, Doc. How you do?
Good morning. Thanks for having me. Morning to the audience as well.
All right. I notice you come very relaxed looking, you know.
I'm always relaxed.
Yeah, but there is, I suppose, whenever men, especially men over 40, hear about urologists and prostate cancer and there's almost like an apprehension. Is it a cultural thing? Is it globally, or you know, do we have a Jamaican problem?
It is somewhat cultural because they fear the prostate exam because it's done through the rectum. But nothing to fear. It's a simple, easy exam. It's something I do every day. And in private, once the man comes to the office, there's nothing to fear, and they all go through it very well.
I had a conversation the other day, just passing conversation, and you know, a gentleman mentioned being on some medication, and he mentioned it was for enlarged prostate. First thing was, wow, we've come a long way that people feel comfortable just talking about it. It suggests that the public education is working, but also for those persons who that might have flown over the head, what is an enlarged prostate and why is that problematic? Okay,
first I think we need to just tell persons what the prostate is in the first place, and then they'll understand.
Right.
So it's a gland size of a walnut. It's only in men, of course, and it's just below the bladder, and then it's connected to the penis. So it joins the reproductive system with the semen and sperm and the urinary tract as well.
Right.
So if it's bigger than normal, then it can squeeze the urinary tract and make it difficult to pass urine. So that is just enlargement, which is a separate entity from cancer.
Right. And so when you are doing a prostate examination, what are you looking for? Is that you're not looking for enlargement, or what are you looking for?
So the prostate exam is done with one finger in the rectum. And the prostate is in front of the rectum. So we push forward gently. It's not painful, and we feel the surface. Sometimes we can detect lumps, hard nodules, which may be suggestive of cancer, and we get a good indication of the size as well. So we're feeling a lot of things at one time.
So when you say everything is normal, everything is good, what have you identified?
Right, so it means that the size is normal, the surface is smooth and firm, which is normal. That's just the examination part in terms of screening, meaning the person has no symptoms. They're just coming for a well visit, a checkup.
Right.
And then we'll incorporate a blood test called the PSA, prostate-specific antigen, which complements the prostate exam.
You say it complements it. It doesn't replace it?
It does not replace it. In more contemporary practice, it has actually superseded the need for prostate exam. So it still plays a role, but even if a man is scared, as you were alluding to earlier, would still have the prostate blood test to do as a screening tool.
So, for instance, if as part of your male executive profile exam that you do, if you do that blood test,
right,
is it? Would you still recommend doing the examination every, I don't know how many?
Well, currently it is still part of the recommendation, but if the PSA result is really, really good within the normal range, meaning very low, then the sensitivity of doing the prostate exam and detecting something is also very low. So some men opt to not do the prostate exam if the PSA is really, really good. And we start in Jamaica at age 40, and we do it annually because our population is at very high risk because 91% of us are black or have some black descent in us. And of course, black men suffer from prostate cancer more than other races.
Is that genetics or is it social genes, social genetics? Is it diet? Is it?
It's somewhat genetic. There are some specific genes, and there are some that run in families that are not specific for prostate cancer, but are associated with prostate cancer. So we can't rewrite our genes. Most black men, unfortunately, have genetic predisposition to getting cancer and also more aggressive cancer. So that's why we target black men more than other races.
One of the things that concerns me is the symptoms or lack thereof, because so often you see men turn up with stage 4 or stage 3, it's advanced, maybe because they weren't doing tests regularly, but by the time they figure it out, it is far gone. What is it about the symptoms that miss us so very often?
All right. When you look at some charts created for men, you go at work and you see a poster or online in terms of prostate cancer education, and it lists some symptoms like urinary symptoms, blood in the semen, black back pain. Let me tell you, I have a big problem with those educational posters because the most common symptom of prostate cancer is no symptom.
Okay.
Right?
Okay.
So we should go for well checkups when we have no problem, just due to age 40, 45, 50. You go into your annual check, just like how you check your blood pressure, you should be checking your prostate. And you spoke about the prostate exam and the PSA testing. So sometimes the symptoms can be due to other problems, not due to prostate cancer, or it can be due to prostate cancer. But if it is due to prostate cancer, it's somewhat advanced.
What about the man them who, like I said, oh, me active, me play ball a week time, me go to the gym, me diet, me this, me that. No, sir, me eat the things that me eat the pumpkin seed and...
Right. We need to kind of get away from that thinking with respect to prostate cancer.
My belly no big.
So, yeah, we big them up for having a healthy lifestyle. And, of course, that protects them or lowers the risk against other illnesses like heart attacks, stroke, and other lifestyle diseases. But the 3 most common risk factors, hardcore evidence for prostate cancer is age, so getting older. Every decade of life increase the risk. Ethnicity, so blacks and Caucasians more than Asians. And if you have one of the genetic risk factors, known genes in the family. So we ask about any family members having prostate cancer, breast cancer, colon cancer, because they're overlapping genes. Right, so the lifestyle risk factors are actually much weaker with respect to prostate cancer. So, you know, obesity, alcohol, eating a lot of red meat, processed foods, and low in fats, vegetables and fruits are associated, yes, but not as strongly as the other risk factors. If you notice the risk factors I mentioned earlier on, you can't do anything about it.
Right.
Age, being black, having the genes. So it's not something that you can prevent per se. So we kind of frame it as a risk reduction with the lifestyle changes.
It sounds like the greatest lifestyle choice that you can have as a man is to have health-seeking behavior then.
Exactly.
Yeah.
So I think that's where we need to focus on. So Prostate Cancer Awareness Month in September is really largely focused on screening, where since we can't prevent it per se, we can detect it early, where treatment is likely to be better with a better outcome.
All right, so for those persons watching this conversation and they're saying, all right, mega do it, or they're saying, mega tell my husband or my baby father, somebody is listening and they want to make a recommendation, where can they come to have a conversation with you to kind of move in the direction of the conversation and getting it done?
All right, that would be a good move. So please encourage them to come for their screening. I am at Neo Medical, which is located at 76 Red Hills Road Business Center. And of course, I work publicly as well at the premier institution of the Caribbean called Kingston Public Hospital.
Yes. People need to know Kingston Public Hospital is a premier
Of course.
healthcare institution,
Of course.
you know.
No doubt about it.
Definitely. Doc, thank you very much for joining us this morning.
All right, thank you for having me.
All right.
Good morning.
All right, my guest has been Dr. Dean Wong, urologist at Neo Medical. Men, talk to your doctors. Women, talk to your men. Let's continue to break the silence around prostate health. It is Prostate Awareness Month, and let us get dialed in and wake up to the reality of taking care of our health. All right, we're going to take a break. Sunrise continues after these.